Good afternoon, everyone. Happy Thursday. Welcome back to part two of Is the Pandemic Really Over on Trap Chat Live. As you can see, we are doing a special show today on a Thursday, and I am so excited and pleased and grateful to be joined by Dr. Bernard Ashby, the Chief Medical Officer at CVC Medicine. He is a South Florida boy, born and raised, a board certified internal medicine, cardiology, vascular medicine, vascular interpretation, and nuclear cardiology specialist. Let's see what else. He's been a professor at Columbia University, served as director of vascular cardiology at Mount Sinai Medical Center prior to opening CVC, and currently is an associate professor at Florida International University. And if he looks familiar, it's because you've definitely seen him on national media outlets talking about many things in health policy, including COVID, which we are going to focus on today. Welcome, Dr. Ashby, as I've been instructed to call you. I'm not going to tell you what he really asked me to call him. Believe it was King, just teasing. But please introduce yourself to the folks.
Thanks, Kirsten. Pleasure to be here. As the young woman said, I go by the name of Dr. Bernard Ashby, or she could call me by my nickname. And I was just kidding about it. Don't call me that in public, please.
Oh.
Proud Florida boy, born and raised, and I'm a vascular cardiologist, but I do pride myself on being an internal medicine doctor first, or a general medicine doctor, and also do a lot of teaching. So very proud of that. More proud of my learning than my teaching. And because I teach, I'm always learning and having to be up to date because students keep you on your toes.
Yes.
So can't be half stepping.
Oh.
I did a lot of media related to COVID, and I am not media trained or special in any way. I think the thing that differentiated me from everybody else was the fact that I don't work for nobody, and so I could say what I wanted to say without having to worry about a hospital administrator yanking my chain, something like that. So I think that's kind of why I was able to express myself more vocally regarding COVID and other issues. So that was that.
That's definitely what I appreciated about you, as I was saying while we were backstage before we went live, that you've been telling the truth, and as we know, for the past 2 years, there's been a great deal of information, but it's hard for someone like me, a non-medical professional, to know what is and is not good advice, or what is and is not a good practice, what we should be doing, and the way that things were changing so rapidly, especially at the beginning. There was a lot of room for error, so we made a lot of mistakes. But now that we're 2 years ahead, I'm going to pat myself on the back, but I feel like I'm one of the only people that's still even reading the news about COVID, that I'm still even concerning myself with it. That's one of the reasons I wanted to do this show. So I'm going to ask you, like, straight up, is the pandemic really over, or did we just get over it?
The pandemic has stopped hurting the economy. So yeah, it's over. It's over. Meaning that, businesses are running, people are going to the movie theaters, people going to the disco. I'm still hip.
The disc. I don't think they're going to the club now.
Discotheque, sorry.
Yeah, discotheque. Okay, you're aging yourself.
Yeah, listening to that, whatever that, Busta Rhymes and all of that Salt and Pepper, that new school music. But that was a joke, by the way.
I got it.
Okay, good.
I listened to all of that.
But you have to separate the public health aspects of the coronavirus, the political aspects of the coronavirus, and then the socioeconomic, historical. There's a lot there And so when individuals are talking about COVID-19 or the COVID-19 pandemic, and whether or not it's a pandemic, that's another point of contention that we could get into.
Mm-hmm.
Um, you have to be very clear on what you're talking about, because depending on who you talk to, they have very different interests, agendas, or even in care. Like they care, different people care about certain things. I mean, if you're a 90-year-old, living by yourself that has diabetes, I mean, COVID's a bigger deal to you than
Mm-hmm.
a 20-year-old healthy, person. So it's just a different thing. But the way the discourse is happening around it, there's a lot of different agendas, a lot of misinformation, disinformation, a lot of propaganda, a lot of scare tactics and manipulation, and it's just hard to get the truth from any source. And I'll be the first to admit that you can't trust any of the trusted sources, from the CDC to CNN, MSNBC, Fox News, New York Times. All of them have, they're all in pretzels with their competing interests and agendas. And so you have to factor that in when interpreting the information. And that has gotten me into trouble because I just follow the science and look at the information
Mm-hmm.
and tell people what it is. And I used to be on MSNBC a lot until they yanked my chain there.
Gotcha.
They were saying some things that they didn't like, but the science is the science.
Okay, so let's fast forward then. You said, you even said for some people it's not even there's a bone there's a some is it a pandemic or not? Like you're saying it depends on who you ask, basically. So, from a medical standpoint, from a science standpoint, how concerned should we be today in September of 2022?
As an American,
Yeah.
it's you're more likely to die from the flu at this point.
Okay.
For most people, um, you know, the game has changed. Omicron brought in a different era,
Mm-hmm.
or after in the COVID-19 saga, and vaccinations, prior infections, early therapeutic options, better treatment modalities, and again, the nature of the Omicron variant in terms of how it affects people is very different. So it's a different equation altogether. That doesn't mean that there's certain populations who are particularly still at high risk. That's still very true.
Yeah.
But for young people, children, not so big of a deal, especially children, not a big deal at all. I mean, ain't no reason to vaccinate your kids. It's
Oh,
no reason to do that at all. And it's just based on the risk benefit analysis in terms of the mortality benefit and the way the trials were conducted. And
okay.
that one is something that got my chain yanked. I mean, I actually looked at the pharmaceutical data that they released. First of all, they didn't release everything. They only released what they felt like. They didn't even publish a paper.
Okay.
They even bother usually you do a publication and then you get FDA approval, all that stuff, but
Yeah.
they didn't go through the peer review process. They went straight to the FDA, said this is what we got, and the FDA approved the vaccines for kids under 5 with very shitty data. And as a parent, I, it would be, knowing what I know, it would not be in the best interest of my child to vaccinate them. That would actually be introducing harm to my child that's unnecessary, unwarranted. But
Yeah, and you do have a child under 5, correct?
yeah, my son's, he's 2, going on 3,
Okay.
and he's asthmatic. He got COVID already. He got Omicron. It was nothing. You know what I mean? It was nothing.
Okay.
And I wasn't worried about it. I'm like, all right, go ahead and shake that off, because he did expect exactly what I expected him to do, which was have a little sniffle and keep moving. And that's the vast majority of kids his age. I was more worried about the flu with him in particular.
Okay.
Our RSV was I was very confused
RSV,
about.
yes. Can you tell folks what RSV is? Because I think that there was a time I know several people who, especially who had school age children,
Mhm.
and there were RSV outbreaks in their schools, and then the parents were getting it as well. So can you explain to the audience what
Yeah.
RSV is and how that differs from COVID?
Yeah, RSV is just one of our common cold viruses, but it's particularly virulent or harmful in uh, toddlers and infants. Particularly
Hmm.
infants can be deadly in a lot of circumstances, and not a lot, but in a not so insignificant amount of circumstances. And so, my son is an asthmatic. I was concerned because it has a particular predisposition to worsening asthma. And
Oh.
when my son got RSV, that's exactly what happened. And we had to go to the hospital,
Mm.
and he was very sick, and that's what I was worried about, and that's what happened. So, but with COVID, I wasn't worried about it, and he had a sniffle, and that's exactly what happened, and that's based on the data. but
Okay.
but you listen to Fox News or CNN, MSNBC, well, Fox.
Not Fox. They don't care.
They're like, yo, ain't nothing here.
Yeah.
But if you listen to CNN or whatever, MSNBC, they act like your kid gonna die if they get Omicron. Like, what about long COVID? What about the long? I'm like, shut up, man. Like, shut up. You know what I mean?
Oh my gosh.
Like, I'm tired. I'm tired of them. Capping. You know what I mean? Like,
Okay.
there's a clear agenda by pharma to push
Yeah.
the vaccines on as many people as possible. They have a clear, blatant financial incentive, and so I'm always, circumspect, when it comes to them in particular, because pharma, all of them, they're pieces of
Mm.
shit. You know what I mean? Like pharma in general cares more about money than people's lives. Like that, they'll let you die, and actually, they're killing people by focusing so much on profit. I mean, look at the insulin issue. I mean, like the stuff they do in broad daylight in the interest of just making money, and they always say, "Oh, it's for R&D." Stop lying, bro.
I
Like
don't want to be a test case. I
no,
didn't sign up for that.
but it's not even a test case. They're saying that the reason why they charge so much is because they spend so much on research and
Mm.
development, which is bullshit. And if you look at the actual numbers that they invest in R&D, it ain't nothing. But they
Mm.
act like it's everything, and that's a justification for running up the tab on us. And so um, they don't give a shit. And so you think I'm listening to them when it comes to this? Like, nah, fuck them. You know what I mean? Nah, straight up. And fuck them. But
Whew.
basically now, early on in the pandemic, I was definitely on the bandwagon. I was like, yo, get your vaccination, which was correct. I mean,
Right.
we had no population immunity, new virus, uh,
Hmm.
re- spread fast as hell with mortality rate, that we thought initially was like 1%, but it, settled out to be a case fatality rate of about 0.3 to 0.5%, which seems low.
Even less than 1%.
Yeah, but you
Um,
multiply that by hundreds of millions, you get over a
yeah.
million deaths, and that's exactly what happened. I mean, I've seen a lot of people die from COVID for sure, but 92% of those people that died were over the age of 50. And I mean,
Hmm.
let's keep it real here, okay? 8% of the people that died from COVID in the United States were less than 50. Okay, wouldn't get that from watching the news, but that's what happened. Okay, and then now we have people who've gotten infected, and the entire U.S. media establishment ignores that natural immunity exists. You know what I mean? Like they're like, it doesn't exist. I'm like, come on, bro. Like you've been lying about that forever, and so they're not even putting that into the numbers. But we all know that natural immunity is a thing. Like that's what we learned in med school.
Okay.
That vaccines were never intended to replace natural immunity. They were just preventing you from going through what it takes to get immune. You know what I mean? So, but obviously, the actual virus is a better substrate or antigen for your immune system to figure out what to
Than
do. So
something
the
else.
next time it sees it, they'll know what to do. It'll see all parts of the virus. But the media got stupid all of a sudden, and so did doctors. And
Mm.
they think that the vaccine is better than getting infected, which makes no sense. And the science slowly says that. I mean,
Yeah.
you got that Cleveland Clinic, you got Lancet, you got Nature, you got all these highly reputable magazines putting out data that shows when you look at head to head, natural immunity is either equal or beats out the mRNA vaccine. You know what I mean? It just is what it is. Now, when you get vaccinated and you have natural immunity, you're even more protected. You have hybrid immunity, and so and I'm an advocate for that. I got hybrid immunity because I got COVID for the first time about a month ago.
After your vaccine.
Yeah, I got 2 doses of the vaccine, didn't get a booster.
Okay.
And that's a whole other story with pharma and how they did the vaccine, because all the data shows that if you do the vaccine doses further apart, you get more higher and longer lasting immunity as opposed to doing it 4 weeks apart.
Closer together.
They won't change it. I don't know why. And that's why everybody who got the original schedule needed a booster. But I didn't do that because I actually knew the data, and I did my doses 4 months apart. And yeah, but yeah, I went off on a long tirade to say that pharma has a clear agenda, and a lot of what they're pushing for, like the 4th dose of the old ass vaccine, that was to me.
Yeah.
And then the ignoring of natural immunity. The CDC released a damn trial that showed 75% of the children that they tested had antibodies already. So why are you vaccinating them? I don't know. I have no idea. But that, they don't think natural immunity exists, but that's a whole nother story. And then, the actual trials, if you look at the trials for the kids, they didn't decrease death. They didn't decrease hospitalizations. They didn't decrease severity. None of that happened.
Okay.
They're, when they're quoting like 50% reduction in the Moderna and the Pfizer, and then 8% of Moderna, what they're quoting is reduction in symptomatic disease. So most of these kids get mild. So they didn't prevent any deaths. Okay.
Yeah.
They didn't prevent any kid from getting severe. You might have prevented 4 or 5 stuff is good for you. You know what I mean? And so there's really no reason for me to give my child that. And Pfizer didn't even show that initially, so they added a 3rd dose in the middle of the trial. Originally, their trial was designed as a 2-dose trial. They looked at the results like, oh, it's trash, and then they added the 3rd dose, and they got their results, and they had a higher efficacy for the prevention of stuffy noses. I think they were the ones that were like 80%, whereas Moderna was like closer to 50%. So.
And what's Johnson & Johnson, like 0?
Yeah, they're not approved for children, so it's only Moderna.
Okay.
Yeah, so prove that. Johnson & Johnson, man, that's an evil company. They keep getting caught, and they just keep paying out. They're like, oh yeah, sorry, we gave you cancer. We'll just give you a couple billion here.
Yeah.
Anyway.
So I was definitely one of those people. Well, I definitely am one of those people who try to consume as much information as I could, so that I could figure out what was, take the good with the bad. And working in the field that I do, working in employment, when I would, and I worked for a fintech company, and everyone worked from home, or worked remotely, I should say. The majority, especially the people that I was hiring, they had that option. And when I started to see a lack of transparency in why they had a vaccine only mandate. And I said this yesterday, and I say this all the time. I've said this on BBC News, everything. I am anti-vaccine mandate. I am not anti-vaccine. I don't think that the mandate is as effective as people say that it is, because what is it doing? It's not doing anything for you. Like I said, especially when you work from home. And, I'm going to be honest that I know more people now, with COVID that have gotten COVID than before the vaccines were even available. We had buildings that had to shut down because even with a skeleton or hybrid schedule, people were getting COVID over and over and over again just from coming to work, for one day. And that wasn't they weren't telling people, that their coworker was sick. They weren't testing people anymore. Do you think that was a misstep in terms of having a vaccine only,
Of course. Yeah.
Model?
Yes. I'm anti-mandate. And, if you just look at the science alone, right? And you put on your thinking hat, what is the purpose of the mandate? Well, they want less people to get sick, but in terms of the business, they don't want you to spread it to other people. If you come in sick and at one point you were less likely to spread the infection if you were vaccinated, but that's not so much the case anymore.
Okay.
And, but that was the main thing. It was like they were talking about this herd immunity. That's the reason for the vaccine mandate, which is bullshit. You know what I mean? Like, especially now. I mean, once upon a time that argument might have made sense, but now that we have Omicron and you're still given, the old, Tecmo Bowl vaccine for Omicron, what you trying to do? Like, we already know that Omicron doesn't recognize it. Like, so, I mean, Omicron evades immunity related to previous variants and the vaccine. People who are vaccinated are less likely to die or be hospitalized, but not less likely to be symptomatic. So that's very clear.
Okay.
But people who are previously infected also have that. It's even more effective because people who get the natural infection, they get more T cell mediated immunity, which is fancy way of saying instead of just focusing on the antibodies, you have another set of cells that you have another set of cells that are more dynamic and can recognize different variants and yada yada. So anyway, the point is that the mandates totally ignored people with prior infection. So if you got prior infection and you're less likely to spread the virus and less likely to die and all that stuff, or it's just as equal to the vaccines, why are you still making those people get the vaccine? Like it doesn't, it defies logic. You know what I mean? And then people who I used to bring this up to, those super like go hard vaccinators, they were like, oh, but how do you prove it? I was like, yo, like you could prove that they got the infection. Did they have a positive test? Because that's the way the trials were. You know what I mean? They're like, but what if the antibody? I'm like, listen, man, the trial said if you got a positive test, they counted you as having it, okay? And then they looked at the data, and the people who got the positive test had less death, less severe disease, less hospitalization than who wasn't infected, and it was slightly better in most circumstances when compared to the mRNA vaccine. That's what it showed. So why are you giving me the argument? Do it. Just do it like the damn trial, bro. Okay. You know what I mean? Like, so if they can prove a positive to it, but what about like, so that's your argument? You know what I mean? So they can't argue based on the science. They always say, well, you're sending the wrong message, and listen, all right, whatever. That's a whole separate conversation. But if you're forcing people to get a vaccine, what is your reason?
Yeah,
I mean,
and what you said at the beginning, it's the economy, like.
Yeah, of course. I mean, it was killing us. I mean, all of the shutdown, it was killing us, and that was their primary concern from the get go. I mean, there's people dying every day from other things. I mean, more people die from heart disease than COVID every year. You know what I mean? And 80% of that could be prevented. If they would, 80% of those could be prevented. 2 seconds, right?
Okay.
You could have a higher impact on death if you focus on that.
On prevention.
Than the pandemic, prevention of heart attack, strokes, all that stuff.
Now, what about prevention of COVID? Like, what do we do?
Yeah, I mean, so the way I would frame it with COVID is that, this is like the mask mandates and all this other stuff, quarantine. We are now in the chronic phase of the COVID-19 era. I'm not even calling it a pandemic. It's a virus that's going to be here for the rest of our lives. I said that before the vaccine came out, and people were giving me crickets, about it and thinking I was crazy. But I mean, like, it's why wouldn't it go anywhere? Now all of a sudden Fauci says it, and somebody else says it. Like, oh yeah, well, duh. I mean, they knew that. I knew that. I just said it. You know what I mean? And now that we have therapeutics, we have vaccines, we have a less lethal variant at a much lower case fatality rate. Like, if not now, then when? Like, what? Like, are we going to still be in this hyper alert phase? Because it ain't going to be.
I'm still there. Like, I'm.
Well, my point is it's going to be the same way next year. It's going to be the same way 5 years from now. Ain't nothing going to change. So are you going to what's going to be your cutoff? Because next year,
I don't know.
Yeah, that's what I'm saying.
I don't know. Like I said, because I'm seeing more people now,
Yeah, I mean, this is
get
the first
COVID.
time I got it. This is the first time my mom got it. Like, it's like the Omicron, the subvariant, the 5, which is the dominant variant in circulation or subvariant in circulation, it's the most infectious virus we've ever had in human existence that we know of. Okay, it's more infectious than the measles.
You never want me to go outside again. Like
Uh,
I'm serious. Like that's always been my goal. Like everyone's like, "Well, do this and you won't die." I'm like, I'm not. That's not a concern. Like I don't even want to get to that extreme. I want to not
yeah, listen,
catch
man.
it. I want to not catch it. Like what can I
Unless,
do to not catch
unless
it?
you live in a bubble, you're gonna
I
get it.
do.
Yeah,
I do.
I don't recommend it. I don't like.
I hear you.
I personally think that that's I don't see the rationality in it. You know what I mean? Like, my mom, who's a cancer survivor, lung cancer,
That's nice to your mother.
and had hip surgery and had knee surgery and is obese and has sleep. She has all the red flags,
Mhm.
for it. You know what I mean? And so I made sure she was vaccinated,
Okay.
but I made sure that she also had access to early treatment. And she got Omicron at the same time I did, and it was lightweight. She had like a little sniffle because she started her Paxlovid very early on, but it was
Okay.
nothing. And Paxlovid in the trials that were done with some caveats, it decreased chances of death by 90%, decreased
Oh.
hospitalization by 90%. It's the cheat code. Like it's literally the cheat code. And the earlier you start it, the better it works. And so you're literally wiping out the virus before it even takes hold. Like that's gangster. You know what I mean? And so I took it. It was lightweight to me, and all of the data shows that. Like, listen, you're giving it a very effective antiviral early on, because people don't die from the actual virus. So it's the SARS coronavirus which causes COVID-19 disease.
Ah,
People
gotcha.
always say I tested positive for COVID-19. No, you don't test positive for AIDS. You test positive for HIV.
HIV.
Causes
Yeah.
AIDS. Test positive for SARS coronavirus, which can cause COVID-19 disease. And the disease is mostly mediated by the inflammatory response from your immune system going hammer time. And so with the Paxlovid, what you're doing is actually clearing the virus before your immune system goes bananas. And patients are relatively asymptomatic. But what's happening is that people aren't getting the therapy. They don't know about the therapy. They're starting it
Mhm.
late. So by that time, the virus is billions, multiple copies all over the place, and your immune system is already hyped up. So you're like shooting a bullet at a tank. And the fact that we're not focusing on early treatment, which is a pharmaceutical medication, right? And I'll tell
Okay.
you how I hate pharma, but
Yeah.
the data is the data, okay? And it makes perfect sense that if you knock out the virus early, that you'll be less sick, and that's what's happening. It's like literally the cheat code. It's turned
Mhm.
COVID-19 into a lightweight virus for most people if they start the therapy. So
Okay.
with
So
my
let's
patients,
let's end on that note, or end the COVID talk on that note, because we're
okay,
getting to the 2:30 mark.
okay,
At CVC, you have something that you call rapid treatment TT19.
yes,
Can you
I'm just about to get into that. Yeah,
yeah, can you explain that, please?
yeah. So basically, the entire wording is test to treat for COVID-19 uh, in less than 60 minutes. So after you test positive,
Hmm.
my benchmark is to have patients start therapy within an hour. And so obviously it's better if you diagnose yourself earlier. So have a low threshold. If you're exposed, if you have a stuffy nose, you know, test. And now that you have a lot of home tests, easy to do, takes 2 seconds, and you could test and learn early on. Because the best time to start Paxlovid or any antiviral therapy is before you have symptoms. Okay, even when your symptoms are mild, the
Okay.
earlier you start, before that virus has a chance to replicate, you nip it in
Okay.
the bud early. Okay, and so it's counterintuitive for some people, but if like you understand the science, it makes perfect sense. And so that's what I've instituted, and it's been a godsend for a lot of my patients, and it's allowed them to live their lives because they had something ready to go if and when they test positive, which with the BA.5, it's hard not to get that virus now. It's just, all the people who are untouched are getting touched now. I mean, like, I remember when Delta hit, I was like, man, like all those people are getting touched now. I remember when Omicron hit, all the people getting touched. I was like, still ain't get it. And then 5 had, so variant 5, and I finally got touched. It happened. I mean, It's hard. It's hard. You're like, the less than 5%, probably less than that haven't gotten infected. You know what I mean? Which is
Well,
horrific.
yeah, I have home tests. I test before I do go, especially around my parents or before I go, you know, to a restaurant or something with to meet my friends. I had to speak someplace, and I hadn't done that in person for a very long time, so I was very nervous. But I tested beforehand, and I definitely would not go someplace without knowing I'm protected other people, like I'm not spreading something.
Yeah, and that's your individual decision, and
Hmm.
and, and there's nothing wrong with that at all. Like if you want to protect yourself and be hyper vigilant, then that's cool. And if people and I think people should do that. Like and if you're wearing a mask, it should be N95, not a regular mask. N90, I mean, the regular surgical joints don't work anymore
Yeah.
for Omicron. That's just you're wearing, you're just wearing a face mask for show because it ain't preventing.
Is there a difference between KN95 and N95?
Not really in terms of all
Okay.
practical senses.
Okay.
They both have high efficacy or effectiveness in preventing virus. I mean, the main thing is that the mask has to be affixed to your face. You know what I mean?
Yeah.
So even if I wear an N95 because of my beard, I got some,
Got some stuff hanging out.
But the more that mask is affixed here, and if the mask itself doesn't let virus through, then you're good. Surgical mask, it's all open, so like
Yeah.
it's not preventing anything at all there, and it makes perfect sense. But in terms of the virus, the phase that we're in, it's like, I mean, if you're not going to live your life, like this is what your life is going to be moving forward. Like that's what it's not going to change. Okay. Maybe they'll come out with some new therapy that gives immunity to it. Maybe, but I know that they have something in the Defense Department that looks somewhat promising, but
Okay.
I don't think it's going to happen. I mean, like it's going to be here for the rest of our life. It is what it is. So, the what I'm pivoting my patients to is making sure that they're adequately vaccinated,
Hmm.
and then they have their pre-treatment plan, their early treatment plan on deck. I mean, so if and when that happens, what's the plan?
Yeah.
Okay, and that's it. And I got the idea from cardiology where we do door to balloon time for heart attacks, where if a patient has a heart attack and they come to the ER, if it's a particular kind of heart attack called a STEMI, you need to open that artery or the heart's going to be permanently damaged or the patient's going to die.
Okay.
And so we have something called door to balloon time where we treat them within 60 minutes, meaning that we have them in the cath lab, with the wire going through the artery, and we're already opening up the artery within 60 minutes from when they come in. And that has greatly decreased the amount of damage to the heart and the amount of deaths related, because a lot of patients come in and it took a long time, and by the time they got seen, it was too late. The heart was already permanently damaged or the patient died. And so with COVID, I see it a lot of the same way. And what's particularly tragic is that so many minorities, particularly Black folks in general,
Hmm.
anybody from the lower class, because obviously there's Blacks from different class, but we're disproportionately lower class, unfortunately, and that's just the way America is. We a lot of us don't know about it, and I know some Black folks, professionals with a lot of money. I mean, that don't know about it. Like I'm like, bro, like how do you not know about Paxlovid, dog? How do you not know about this? Because I didn't know, But like if they spent half as much energy talking about early treatment as they do talking about damn vaccinations, it would save thousands of lives. But there's people are so obsessed with the vaccinations, the Democratic Party and the liberals, like Jesus Christ,
Now
like
you're speaking my language.
yeah, you're beating a dead horse, dog. Like
Yeah.
beating a dead horse. I mean, people have already made their decision. Cool. Now, I mean, like, what else can they do? And you even see doctors now that when patients test positive for coronavirus and they're symptomatic, they're not doing anything for them. You know what I mean? But you're waiting until they get sick, and then in the ER, that's when you want to start doing stuff. And
it's too late.
It's too late for most people. They're going to end up with a tube, and they'll survive. But I still see people dying today that's coming in the hospital, super sick, and they got no early treatment at all. I'm like, when did you find out? They was like, oh, last week. What happened? Like, oh, I took some NyQuil and some vitamin D. I'm like, what the hell is that? Like, what are we doing? You know what I mean? But a lot of doctors, they still refuse to provide treatment for their patients. And that's unfortunate.
Oh, well, I will say that, I came here completely, isolationist, and you have eased my anxiety and my misgivings a bit. I appreciate that. 'Cause like I said, I was very comfortable with staying in the house for the rest of my life if these people want to continue to be outside, spreading COVID. But I do appreciate you sharing your facts with me, which is why I'm talking to you and not solely relying on the articles I read and deciphering information that I'm seeing online. Final thoughts on COVID, because I do want to give us a chance to do a little bit of fun stuff. Some trap stuff real quick.
Well, COVID, like I said, COVID's here to stay.
Okay.
Make sure that you're adequately protected and have a plan. So, again, if you got the infection before, you have some great protection. If you got vaccinated before, you have some great protection. If you had both, you have the bestest protection. Okay. And if you've never gotten vaccinated or you've never gotten infected before and you get Omicron, good luck, especially if you're older and have some comorbidities. If you have no immunity at all, Omicron's still clipping a lot of those people. So Omicron looks like it's not as severe as, Delta or some of the other variants, but if Omicron happened at that time, it would have been massive deaths for sure. And one of the things that I mentioned, and I'll wrap it up here, was that there was this narrative about incidental Omicron in patients coming into the hospital where they said they test positive, but they don't have any symptoms or yada, yada. And I had to blow that up because a lot of those patients, they're not there for, fractured elbows. They're there because their diabetes is out of control, because they have a heart attack or they have heart failure, they have COPD exacerbation. And so even though that's not why they presented, Omicron makes that worse. I mean, any viral illness or illness that causes inflammation will make any chronic medical illness worse. And so that's what I've seen. I've seen it time and time again. And I saw it up front with Omicron. I'm like, damn, like the hospitals are flooded, but they're saying people aren't sick with Omicron. Well, these people had Omicron and it was lightweight because the earliest variants weren't as bad as, each subvariant was different, but 5 seemed to be a little bit more virulent. But either way, they might have had like mild symptoms, got over it, but then presented a week later, days later with, hyperglycemia, acute kidney injury, all these things. And it's because of the inflammatory process. And this is precisely why I'm so fixated on early treatment, because, it's not just decreasing hospitalization and death directly related to COVID. It's preventing that inflammatory response that leads to heart failure and a lot of chronic disease exacerbation. So, if you have a parent, if you're high risk, do what you can, whatever, to prevent it. But it's more important now at this phase of this pandemic to have a treatment plan. So, and there's nothing wrong with having both. Okay, yes, you can do whatever, live in your bubble, but somehow something gets in the bubble. Like, what's the plan? And I see too many bubble people who don't have a plan. They just kind of sit at home, which doesn't make any sense.
No shade, as they say. Yeah.
Well, ain't nothing wrong with being a bubble, but at least have a plan. Like if your goal is to try to
prevent it,
from dying, well, you want to prevent it because you don't want to die, you don't want to get too sick, you don't want to get long COVID, right? All those things. And early treatment solves a lot of those questions. You know what I mean? Okay. Like,
yes, sir.
Chances, I can't prove this with the data yet, but eventually I'm going to be proven right, because I don't need to do a randomized controlled double-blind placebo control trial for everything. It's just obvious that if your symptoms are milder or much less, the likelihood that you're going to have long COVID are much less. Okay. And that's what antiviral therapy does. And so that's important to people.
I may bust the bubble here, or at least peek out
Yeah, I
Here's
mean,
to
life is short, man. Life is short.
it
That's all I
is.
can say.
It is.
You know, it's like there was way too many people dying alone and by themselves, especially
Mm-hmm.
the elderly folk. That was tragic. At one point, it made sense, but you know,
Now,
like,
no.
like my grandmother, all my high-risk patients, I encourage them to live their life, and I let them know that we have a plan. We have a direct communication plan. I tell them what to do. I said, do not wear the surgical mask, wear the N95 mask
Mm-hmm.
if you're going to protect yourself. I give them the information. I don't have them like just irrationally scared with their surgical mask and gloves on and no plan afterwards. It don't make no sense. So at least be practical about it.
Well, thank you for the truth. Thank you for backing it with the science. And like I said, you have eased my stronghold on isolation a little bit. Appreciate that. But let's have some fun. So when I am in the bubble and about to, having a difficult work day, there's a song that I might put on, to ease my pain, or if I need to get my day started and motivated, there's some songs that I might want to go to. So what is that for you? When you want to get your day started, get hype, what are you putting on?
It depends on my mood. You know what I mean? So
Okay.
like I love music. Sometimes I'm in a trap mood. Sometimes I'm in an R&B mood. Sometimes I'm in a calypso soca mood. But to be honest, like if I'm particularly stressed, like I call it my teddy bear music, like the thing that like makes me comfortable.
Uh-huh.
Like what do you mean? Like the calms my anxiety is actually like old reggae and old soca music.
Okay.
Because that's what I grew up in my house, and an old, like not old now, but like 80s, like hits and oldies, kind of like we have Hot 105 down in Miami. That was my mom's favorite station.
Okay.
So you get somebody like Luther Vandross or some Gladys Knight or something. But like those remind me of my childhood, and it kind of is like it's like sucking my thumb to me.
The teddy bear music.
Yeah, I put on some Barris Hammond or something, and I just vibe, and that calms me down.
Okay. What about when you need to get hyped up? Is there a go-to song?
Oh yeah.
Okay.
Trick Daddy, Can't Fuck With This Out.
I've never heard that.
That is the hardest drop ever. Like everybody thinks Dream of Nightmares is the hardest intro.
I don't know. I'm aware. I think that's a good song, but
I love that song. But
yeah.
Trick Daddy, when that joint drop, put it on.
Okay. You can't F with the South.
Yeah.
Okay.
Anybody want to motherfucking die? Come see. Yeah.
So it's like Knuck If You Buck level.
I got hype, boy.
It's Knuck If You Buck level.
What's up?
So it's
yeah. I mean, it depends on where you're from, though, because it depends on where you was at when you heard it, what you was doing.
I got you. So I think for me that would be my Ice Cube. No Vaseline. I think that would be like the equivalent of that, because if that comes on, like, I'm glad y'all set it off. Woo! Used to be hard, now you just wet soft.
There you go. But it depends on what you was riding with, like at that time.
It's harder than like the intro, like the Tupac. It's harder to hit them up. Like when Tupac's like F them, F everybody, like your mom, your whole crew.
You hit them up. That's a whole nother lane, and then you talk about Ether.
Trick Daddy is just is above that.
I'm just talking about the intro. I'm talking about like if I want to go fight, you know what I mean?
Oh, well, okay.
All right. I don't want to brag anything, but I haven't lost a fight in like 2 weeks, so I've been practicing. But
your son, you caught your son slipping?
Oh man,
You snuck him.
I
know.
My son don't want it with me. But
okay.
no business fighting at this point, man.
Okay.
But yeah, like you got certain music that turns you up, and it depends on the mood.
Okay. All right. So let's see. you're a very accomplished professional, like very accomplished, very lettered, all of that. What's the best career advice that you didn't take? Like,
Oh, yes.
yeah.
I decided not to become, not to pursue academic medicine
Hmm.
and be a little bitch for the hospitals and the schools.
Okay.
Yeah, because that's exactly what doctors are. You know what I mean? Like they
Oh.
put you on these pedestals there, but you don't have any real power. You know,
Mm.
you can be the chairman of whatever division, but you still answer to,
Someone
such and
else.
such with the MBA or the law degree. That's your
Okay.
boss. And
And what's the best career advice? So what's your
Mhm.
best career advice that you did take?
um, I don't know. I've had so much career advice. I think ultimately for me, like I'm very passionate about inequities in medicine and
Hmm.
about preventing people from dying unnecessarily and improving quality of life.
Okay.
And, and I think the I learned from people about power and what it takes to really change your circumstance. And what we learn in academia with diversity, equity, inclusion, and that's what we practice in the business world. I think all of that is stupid, and so I'm all about not asking for anything. This is what we're gonna do. Like either you get with it or you don't. And our prior leaders back in the day, they either did it themselves or they leveraged whatever collective power they had to make those changes. And so I'm just done with the trying to tell people that tell white people that black people got it hard. Like at some point they don't care, okay? Like especially in the
They don't.
hospitals, like they're making money, okay? Like if you could tell them how to care and make their money, then they'll listen to you. But a lot of us don't really understand that part, and we like describe the history and say, oh, another disparity study. Like, oh, can you believe black people die? Like, goddamn, how many studies are you going to publish saying that black people die from more? Like,
You're you're touching on a lot of people's bread and butter right now. A lot of
Yeah.
people make money off of studying.
Oh yeah, like I'll be your DI expert. You just give me the consultant bag, and I ain't mad at you. Go get your bag. But in terms of that, is that decreasing death? Is that decreasing inequities? No, it's not. Okay, it's not. But I guess more people are aware. That's cool. But America ain't never worked like that. America ain't never worked
Mm.
by asking for anything. And anybody that knows American history knows how it works. And any concessions that we got from power was because they got forced into it, and that's how it has to be. You know what I mean? So go and beg the CEO to treat you more equally, but you know, what they won't tell you is that Medicaid doesn't pay very well. A lot of the black
Mm.
people on Medicaid, so they hurting the bottom line. So get them out of the hospital. That's what they're not going to tell you. That's what they do. You know what I mean? And that's what we saw in the pandemic. It was like right in front of everybody.
Absolutely.
When New York was screaming, New York was like, "Oh, everybody dying." And you go to New York, and all the people dying in the Bronx and Brooklyn, but the hospitals in Manhattan they chilling, and they there was no they were actually actively blocking patients from being transferred to the
Admit it.
hospital.
Wow.
They're like, nah, we don't want that. But they sure did take all of the health the corporate welfare that they got. PPP loans and the hospitals got paid out the nose from the government. And those hospitals that didn't have the same influx as a lot of these other hospitals, they got more money because they were bigger organizations. So
Mm.
so it's all a hustle, and you could DI your way and make them feel guilty, but they ain't gonna feel guilty. Like it's only gonna change if you force them. That's it. Period. So,
Whew. Well, I have learned a great deal today. I have truly appreciated your insights, your realness. Uh, it is refreshing. And like I said, if you didn't reach anybody else, you reached me. I'm might not be a hermit for much longer. Yeah, what did the youngest say? She outside? Probably
yeah,
not, but maybe once or twice more than
live your
more.
life. Live your life.
tell everyone where they can find you or what's next. If you got any appearances coming up, if you want to shout anything out, now's the time to do that. Drop.
All right, shout out RM Moran gang. Shout out Cody Street. That's my block. Shout out to what's so funny?
You are a mess. Like you're probably, like your patients are very blessed. They have a fun doctor. Like, come on, man.
I got an appearance. You catch me out, yo. Or 500.
Shout out Cody Street. Shout out Rap Snacks.
Yeah, man.
Oh man, well, I'm going to shout him out. Follow him at Ashby MD. Like I said, y'all know me. I joke and I fool around. However, it's all for a purpose, and I like to connect myself to people who are informative and who do informing, who teach, who assist, and who don't sugarcoat. And you saw that today with Dr. Ashby. Definitely not going to do that. So go ahead and follow him. Like I said, keep up to date. I do hope to see you again on maybe MSNBC. I'll let you back on. Probably not, because you've been here with me. Not that they know me, but I like to think that I'm low-key famous. Maybe we'll see you on CNN. I know you've been on BNC, some other channels. I'm sure they know you all around South Florida. Shout out to my family in West Palm Beach. How y'all doing? And it's been great. We'll be back next week. We're not talking about COVID anymore, but we will be talking about mindfulness. I will have Alicia Ramsdell, the CEO of a mindfulness organization, coming to talk to us about making your career a reality, getting through the stress. So please join us at the regular day and time on Wednesday at 2:00 p.m. Eastern. I will see you then. Thank you again for joining us. Make sure you follow Dr. Ashby. Tell him I said what's up when you slide in his DMs. All right. Have a good one, y'all. Bye-bye.